Welcome to this week's edition of the Health Policy Institute's Economic Impact of COVID-19 on the Dental Care Sector webinar. I'm Marko Vujicic. This week we're trying out something different. We are just going to record the highlights of our latest research and send that out. We're not doing a live webinar, and this is that recording. So today my focus is going to be on updating you on the latest data from our ongoing HPI Economic Impact Poll. This week we also have questions of the week that focus on the theme of hospital operating room time and potential disenrollment of dentists from the Medicaid program. That's the focus of this week's questions of the week. And as usual, I'll give some highlights of the latest consumer polling research that we've gotten from our partnership with Engageus, and we'll tell you a little bit about that later. So jumping in as usual, we've been doing a bi-weekly poll since the middle of March. For those of you that have been following us, we have core questions on the status of your practice, the volume of patients, collections, the status of the dental practice staff. We also do thematic questions of the week. And we have roughly around 4,000 dentists in a nationally representative sample. All this is available at ada.org/virus or ada.org/HPI as well, if you'd like more details. Jumping into the latest data. So what we do each wave, every 2 weeks, is we add another bar to the bottom of each of these charts just to familiarize yourselves again. The first question we ask is, what is the current status of your dental practice? And again, this sample is dentists in private practice. We also do a separate monthly polling of dentists in public health settings. Look for that as well in the coming weeks. But if you look at the week of August 10th, there's not much change in terms of whether dentists are open or closed. So as of the week of August 10th, 98% of dental practices in the US were open. This was roughly the same as 2 weeks prior, with slightly more practices reporting quote-unquote business as usual in terms of patient volume. But we've roughly stabilized here at about 98% of practices reopening. BLS data is another way of looking at the rebound in employment. This is measuring the total employment levels in dental offices as a percent of pre-COVID, or more specifically January 2020 levels. The green line here is the dental sector, i.e. employment levels in offices of dentists. The red line is employment in offices of physicians, and the yellow line is employment in offices of other health practitioners. And as you see here, in April, dentistry had the most massive employment reduction of any part of healthcare. We were down to less than half of pre-COVID employment levels, meaning half of the sector lost its jobs. The rebound's been just as fast and furious. We're up to 93% of pre-COVID levels in terms of total employment nationally in dental offices. Pretty remarkable recovery. And you can compare that to other sectors. So the BLS data show dental offices are back to 93% of pre-COVID-19 employment levels. Very much in line with what we just showed you previously and what I'll show you in a sec. So in terms of patient volume, this is a really important chart. Again, we just add the latest wave of data to the bottom here. And as you see here, if you just follow those percentages, which are our estimates of what is nationally the estimated patient volume as a percent of pre-COVID levels. And our latest wave of data from the week of August 10th, last week, indicates it's at about 73% of pre-COVID levels, and that's not changed much from the last few waves. So nationally, patient volume is leveling off. Patient volume is estimated at 73% of pre-COVID levels for the week of August 10th. And this is largely unchanged from the last couple of waves, more specifically the last month. So definitely we are calling this the emergence of a new normal. Um, because of how we measure this, we think if anything, we underestimate the true value. It likely is a little higher than, let's say, roughly 3/4 of pre-COVID levels. But the important thing we want is to track over time, and this does seem to be leveling off. So kind of the recovery is tapering off, and again, 98% of practices are open. Employment is back to about 93% of pre-COVID levels. Patient volume, roughly, let's call this 3/4 of pre-COVID levels. And these values have stabilized in the last couple waves of data, or let's say the last month. Interesting thing we looked at was whether the patient volume is correlated with the income level of the area that the practice is located in. So one hypothesis being, could it be that high income areas are seeing recovery in patient volume and low income areas are not? So what we did here is we split up our sample of dental practices. We know their zip code, so we're able to identify the median household income in that geography. And we split them up into low, middle, high income areas going from top to bottom. And we simply just rerun our patient volume data according to whether the practice is in a low income area, the bottom bar, a middle income area, the middle bar, or a high income area in the top bar. And again, the green zones are the practice has, let's say, relatively high patient volume, and the red bars are successively smaller values in terms of your patient volume. And you do see some difference. You do see the, let's say high and middle tend to have more dark green than the low. The low tends to have a bit more of the red and orange shades. And what that means is our insight is patient volume is lower in practices located in low-income areas, but not by much. We don't think these differences are the magnitude is that significant, but there's some variation. We're not showing it here, but we also looked at the patient volume according to the level of COVID transmission in that geography, specifically in the county that the practice is located in. So what we were testing is, okay, do high COVID incidence areas have relatively less patient volume in dental offices than low COVID incidence areas, again, among the general population? And there we did not find a correlation, meaning that it doesn't really matter what the COVID infection rate is in terms of new cases per capita in the area. It didn't relate to patient volume in dental practices. And I think that's important. I guess that's showing that, patients even in higher than average COVID transmission zones of the country, or states or counties, still feel comfortable going to the dentist to the same degree as patients where they're living in areas with very low COVID transmission. Back to our core question of dental practice staffing. So the way we ask this is your dental practice paying staff this week? And again, you see there is some increase in the green bar, which is, yes, I'm paying all my staff fully. And incidentally, 93.8 is right exactly where the BLS government data line up. So HPI data here, they're a bit ahead, but very much in line. They're telling the same story. So according to this, basically staffing in dental practices continues to slowly grow and is at 94% of pre-COVID levels for last week. Now, if you joined our previous webinar 2 weeks ago, we did a deep dive into why practices that are at less than full staffing are at less than full staffing. And the main reason we found was that the practices had a tough time hiring back staff, particularly hygienists. So there is certainly, the data do support the idea that there are members of the dental team that are reluctant to come back. We can't identify what those reasons are, whether they're economic, family reasons, safety reasons. It's likely a combination of all of the above. But the data do confirm that there is emerging potentially a staffing shortage, particularly among hygienists, but of other dental team members as well. We also look specifically at non-owner dentists, and this is a cohort of the dental team that in our data indicate they've been hit kind of hardest by the pandemic. So you see here, it's the same data as a previous chart. Green means you're paying your non-owner / associate staff fully. Yellow is you're paying them partially, and red is you're not paying them at all, meaning they've been permanently let go or laid off or furloughed. And I think what's important here is to just, you see that the green bars are stabilizing at roughly, let's say 75%, 3/4. So basically 3/4 of employees / associate dentists have been hired back and are being paid fully. 1/4 of them are either being paid partially or not being paid at all. So our insight here is employee dentists have seen the biggest lingering employment effect. About 3/4 of employee dentists are now being paid fully. And for those not being paid at all, only about 1/3 are receiving unemployment benefits. So I think it's important, this cohort of the dental team, the non-owner dentists, they've been hit pretty hard by the pandemic and the employment shock, and are among the last to be hired back. And I think our data are showing is this kind of may be it in terms of growth. The green bars are starting to stabilize there at about 3/4 of staff being hired back and being paid fully. Finally, in terms of some of the core questions we ask about PPE, these are the latest data from last week in terms of how many days worth of the following PPE does your practice have. And the punchline here is this is largely unchanged. It's now been several waves, 4 or 5 waves of data, meaning roughly 2 months, where the stockpiles of PPE in dental offices have been roughly the same and have stabilized. So you can see the data here. Just another reminder, if you want these data state by state, they're at ada.org/HPI, just link on the COVID page. You can get access to all of these reports with state-by-state breakdowns, which I'm not presenting today. We also have an interactive dashboard to look at the core questions of whether practices are open, what the patient volume is. We have that in a very easy Tableau-based interactive tool on our webpage as well, where you can look at your state, what is patient volume, and how does that compare to whatever other states you want to look at. These PPE data are also available in the long form of the report. Again, that's all on our webpage, and you'll have the contact info at the end as well, but it's ada.org/HPI. And if anyone gets stuck, please email us at hpi@ada.org. So PPE availability in dental practices has been stable for several weeks now. Gowns and N95/KN95 masks remain the biggest issue relatively. All right, now diving into the questions of the week. The first one we asked was related to this issue of scheduling hospital or surgery center cases under general anesthesia. And a very small share of our sample, about 7%, actually do this. So again, these are dentists in private practice. And the interesting thing is there are variations by practice size and by whether or not the dentist is enrolled as a Medicaid provider. So for example, solo dentists versus large group practices, big difference in the likelihood that they schedule cases under general anesthesia in hospitals or surge centers. Same thing at the bottom there, Medicaid providers way more likely to be collaborating or scheduling cases in hospitals. So this is just, it's not surprising. I think the high need population, again, disproportionately in Medicaid that requires these types of services. And again, we know that large group practices are way more likely to be seeing these types of cases and having collaborative relationships with hospitals. So that's just telling us kind of the lay of the land. The real thing we asked was, okay, prior to the onset of COVID, what was the approximate wait time for your cases to be scheduled in the hospital / surgery center? And then you see here, roughly half, let's say 46%, if you look at the top bar, 46% of those respondents that do schedule these cases basically could get the patient seen within a month. Another 47% 1 to 3 months, and then a pretty small share have a wait time of 4 or more months. But if you look to the right, there is variation according to practice size, as well as by Medicaid enrollment, whether the provider is a Medicaid provider or not. And you see here, the insight there is large group practices and Medicaid providers generally have actually longer wait time for cases. And we don't know why. This could be that they simply have more cases. Maybe the smaller groups have some type of one-on-one relationships, get these cases seen sooner. We don't know, we're just reporting what the data show. But this is the real insight and the important thing we wanted to look at. What is the current status of scheduling these cases compared to before COVID-19 hit? And so respondents were able to choose, okay, I'm scheduling cases roughly the same as before. Right? No change in wait times. That's the green bar, roughly half. But the other half are either not able to schedule cases at all, which is like a big concern, that's the 8%, or they're having a tougher time finding hospital operating room time, which is the yellow bar. So half have not seen any big change, and half are having a tougher time scheduling the dental patients in hospital or surge center operating rooms. And the bottom tells us why. What reasons did the hospital/surge center provide for the limited or denied procedure? And you see here, by far the biggest reason is there's other cases that are deemed greater medical necessity. And honestly, in a pandemic that is by no means under control, that's understandable. So COVID-19 has led to more limited scheduling of these cases, the dental cases, due mainly to increased volume of other cases that are deemed more medically necessary. Other question of the week we asked was, about a quarter of our sample are Medicaid providers, and we asked them, they were Medicaid providers pre-COVID. We asked them last week, has your practice disenrolled from Medicaid since the onset of the COVID pandemic? And only 6% have through August 10th, the week of August 10th. The Medicaid providers that have not disenrolled, we asked them the second question, are you considering disenrolling from Medicaid this year, anytime through the end of the year? And there we got 16%, an additional 16% that said, yes, I am considering enrolling. Now, we don't know how certain that is, etc., but it is a warning sign, let's say. Yeah? So COVID-19 has caused 6% of Medicaid providers to disenroll from the Medicaid program already. Another 16% are considering disenrolling by the end of the year. What we don't know, and what we're still going to dig deeper into, was who are the people that have disenrolled and who are the ones considering disenrolling. And what we're really interested in knowing is, you could think of a private practice who sees, one Medicaid patient a month or one a week even. That's very different than a provider who, let's say, at least half their caseload is Medicaid patients. There's a different impact on access to care for those two people disenrolling. So if it's folks that kind of don't have a high patient volume under Medicaid disenrolling, that's not as big of an impact as if like the hardcore, 70% of my practice is Medicaid. If that person disenrolls, then that's a bigger effect. So we're going to dig deeper into that. My hunch is the people disenrolling are actually the ones that are seeing financial effects, and maybe they can't take as much Medicaid anymore. But again, we look at these, and at least for now, there isn't some huge alarm going off. 6% certainly is not trivial. But again, this is among private practices. But I guess we're going to be monitoring this, because potentially another sixth, the 16%, disenrolling could significantly have some effects. So the nice thing is we know where these providers are located. We could merge in some basic data, so stay tuned for that. Okay, the last part we want to focus in on is the insights we've gotten from our consumer polling. It's been really, really valuable. We partnered with Engageus, who in our view is the leading firm that's kind of has the pulse on what households are thinking in terms of their behavior and their attitudes. So let's go into some of the more recent data we've gained from them. So here is an important chart that we update every wave. And the last data here are from August 5th. Again, this is a representative sample of US households. And one thing they measure is what percent are willing to engage in any of these activities without hesitation. So right now, about 3/4 of the population either have gone to the dentist in the last month or are willing to go. And the point here is that dentistry ranks very, very high here on all these different types of activities. Visiting a physician's office, a little bit above in pink there, visiting a retail store, but that's kind of it. Dentistry is pretty high, and don't make too much of the last little decline there. These data have some noise in them. But you see there from July through August, most of these curves have taken slight downward trajectory, meaning households are starting to get nervous again. The pandemic is kind of resurging. And I guess we'll see what the next wave brings, but we don't know of anybody else that has this type of pulse on what consumers are saying about their dental care in a very robust way. But anyway, dentistry ranks pretty high in terms of things people want to get back to and what they're comfortable getting back to. This kind of breaks that up a bit more specifically, and this has been a chart we've presented a few times. But this is the attitudinal breakdown towards dental care among US households. So again, 22% have actually gone to the dentist in the last month. Another 52% are ready to go now without any hesitation. And then we have another quarter that break out with what we call assurance seekers. They would be willing to go to the dentist as long as some combination of local or national medical authorities, governments, or their actual dentist provides them assurances that it's safe to do so. So the ADA has been working hard to put tools in the hands of dentists, for example, to communicate the safety, obviously collaborating with CDC and OSHA and other entities to kind of consistently give the message of, look, there are new guidelines, there are new safety protocols, they're evidence-based. There have been cases of positive COVID diagnoses among dental team members. But we haven't been able to identify cases of transmission yet to patients, let's say within dental offices. Anyway, all that information is getting out there. It's making a difference, as you'll see in a second. But anyway, there's about 11% of people that are not going to the dentist because they need some assurance, or they need some nudging. They need somebody to tell them that it's actually safe. The 15% is a different population. They are not comfortable going back to the dentist unless there's a vaccine or a proven medical treatment for COVID. So this is a tougher population in a sense to convince to do anything, not just dentistry. But they're very hesitant. So again, when you look at this pie, our take here is that at least for now, we're probably looking at a short-term ceiling in terms of the maximum share of the population willing to go back to the dentist. And these are patients. These are people that have been to the dentist a year ago. Anyway, that share is 85%. So put another way, patient volume is probably not going to exceed 85% of pre-COVID levels, at least in the short term, on average, according to these data. It doesn't mean practices themselves can't exceed it. July has been like an incredible month production-wise for many practices because of all the rescheduled patients from April and March and even May. that's different, right? So you can have your best July ever, but when we look long term, what households are saying, we're looking at basically 85% of pre-COVID levels in terms of patient volume being the short-term ceiling because of these attitudes. Really, really, really insightful. In terms of who patients trust for their information, this is from a couple of waves back, but we did want to just bring it back. Which of the following entities would you trust to declare that it's safe to go back to the dentist? CDC by far number one, ADA number two, local health departments number three, and then dentist office, and then friends and family, I guess. So interestingly, we did not include WHO in this wave. We're going to redo this question, including WHO, to see if the public specifically trusts WHO versus CDC, et cetera. We'll see what those data show, just because of last week's announcements from WHO. So anyway, this is just a testament to the importance internally about how much we've been working with within the ADA to work with CDC and other entities to kind of put out consistent guidelines. Maybe that wasn't the case early on in the pandemic, but it certainly is now, and I think things have been much smoother and people are giving more consistent messages, and that's translating to more comfort and more reassurance that the public is feeling, and is showing up in a pretty robust recovery in terms of patient volume. And lastly, an interesting thing, just because recently the ADA came out with official policy that dentistry is essential. That's not something, I guess, that's news, but it's important that it's out there because, we, depending on where shutdowns go again now, going forward, I think dentistry, I think, and the ADA certainly thinks, dentistry is essential and does not belong on a list where things should be shut down during a pandemic. Certainly not. But I think what's really important is that the public absolutely feels the same way, and that's what this chart here shows. So here's the question households were asked. Imagine your state experiences a spike in COVID cases, and the governor declares that another lockdown is needed. Which of the following establishments should be allowed to stay open because they are essential? And there's three that stand out. It's grocery stores, pharmacies, and medical/dental offices. So dentistry definitely is viewed here as a core essential service by the public. Interestingly, liquor stores down in the middle at 23%. I remember I live in Chicago, so there was an issue in the first wave back in March and April. Are liquor stores essential? Should they stay open? But the public here clearly views dentistry as one of those core services that's part of basically healthcare and medical care that ought to remain open. So again, if we were to just summarize the takeaways from last week's data, again, as of the week of August 10th, 98% of dental offices in the US were open. Patient volume was estimated at 73% of pre-COVID levels, staffing at 93% of pre-COVID levels. And these values are roughly unchanged since our last wave of data. And I think what's important is this is indicating, the emergence of a steady state in terms of economic activity. In terms of the next two bullet points that relates to the safety net issues we're looking at, definitely we've seen now COVID resulting in more limited hospital/surgery center availability for dental cases, due mainly to the surge the pandemic has brought to hospitals, increased cases of things that are deemed more medically necessary. Pandemic could potentially lead to reductions in safety net capacity. About 6% of Medicaid providers in private practices have disenrolled from Medicaid since the start of the pandemic, and about 22% intend to disenroll by the end of the year. So that potentially, if it happens, would be significant. We'll monitor that. And then again, new consumer polling indicates that about 3 out of 4 people who visited the dentist last year are comfortable visiting the dentist right now. Another 11% would be willing to go if they had some assurances that it is safe, and the remaining 15% are waiting for a vaccine or a proven treatment. And again, this 11%, the ADA and certainly others are really working to put information out there, and it's getting out there. Again, in collaboration with other agencies like the CDC. Anyway, accordingly, patient volume in dental offices, in our view, likely has an upper bound of around 85% of pre-COVID levels for now. I want to emphasize, we're not talking month-to-month fluctuations. Again, you're going to have a really, really busy July because of rescheduling, and October could be slow. We're talking macro. When you wash all that away, what do you get? Roughly, we're predicting 85% of pre-COVID volumes in terms of patient levels in the near term. So taken together, data suggests the dental care rebound is starting to taper off, and we're reaching, if not already in, the new normal in terms of patient volume and hiring. So again, if you want this, more details, the reports are available at ada.org/HPI. For those of you potentially interested in some more refined analysis, we could look at state-by-state data in many cases. If you're interested in potentially commissioning some proprietary research from us as well for your firm, contact us as well. And if you have any more questions as well, please reach out at hpi@ada.org. So thanks for listening to this week's update, and stay tuned for more in the coming weeks. Thank you.